Hello, I'm Dr. Jerry Williams with Urgent Care 24/7, here to talk to you today about influenza, the flu. And with everything we've had going on with COVID-19, uh, influenza understandably has taken a back seat. And we've actually seen very little flu during the COVID-19 epidemic, especially in 2020, 2021 flu season. Now, at the very beginning of COVID-19, we did see some flu, and actually about 20% of all COVID-19 patients also had influenza A, B, or both. And at Urgent Care 24/7, we actually saw some of those patients. They were very sick. But with the measures that have been employed to control the COVID-19 pandemic, there's been very little influenza uh, nationally, where our urgent care centers are, which is all over the southern half of the United States. We've seen almost no flu. But it's still an important topic because flu's coming back, flu's endemic, and we need to talk about it. First of all, want to talk about the topic of flu shots. And I know it's a hot topic for some people. I have people tell me, oh, I'll never get a flu shot. The only time I got the flu shot, I caught the flu. Well, first of all, the flu vaccine is not 100% effective, and it actually varies from year to year on how effective the vaccine is, because the vaccine manufacturers are having to predict what the flu virus is going to mutate into for the following flu season to manufacture those vaccines in advance. So it's really a challenge for them to get it right, and they get it right more than they don't. But the vaccine is variable in its effectiveness from year to year. But one thing I do want you to know is that you're not going to catch the flu from the flu vaccine. So I hear a lot of people say that, and it's just not true. Secondly, I want to talk to you about what you should do if you get the flu, if you think you might have the flu. And first and foremost, you need to go get evaluated and seen and get a flu test immediately. Because even though flu isn't as deadly as, for example, COVID-19 is, the flu can be a very, very serious illness, and it does kill people occasionally. Usually it's the very young or very old, or people who are infirmed, who have underlying medical condition. But occasionally, influenza will kill a perfectly healthy person. And so it's really important that if you think you've got influenza, to go get a flu test, a rapid flu test, and if it's positive, get treated. The main two drugs that are used for treating the flu are Xofluza, which is a one-time dose medication that's an antiviral, and Tamiflu, which is a medication, again, an antiviral that's given in the first 48 hours or so when you've come down with the symptoms of the flu. Now, we've talked about this in my COVID-19 lecture, treatment of COVID-19, but we'll talk about it here for flu. These antiviral drugs are effective when given in the first 48 hours or so of the influenza infection, when 48 hours or so after the patient becomes symptomatic. And what these antivirals do is they stop the replication of the virus before it can reproduce or replicate in a large, high volume, and thus infect the host with a large volume or viral load of viruses. So that's why there's a treatment advantage for getting the antiviral medications in the patient as quickly as possible during that first 48 hours. After that period of time, these drugs are not felt to be very helpful. So that being said, it's really important that if you think you might have influenza, to go get seen immediately and get a flu test. Now, the other issue about flu is a lot of people think, oh, well, it's summertime, so it couldn't be the flu. Well, flu is around all the time, though it is certainly more prevalent during flu season, which is the late fall, early winter through late winter, early spring. But you can get the flu any month of the year, and I've actually seen both flu A and B in June, July, and August. It is uncommon, but we do see it. So don't if you've got all the symptoms of flu, and we can go over those. It's a pulmonary infection, so you worry about cough and fever and runny eyes and runny nose, body aches, and you can also have nausea and vomiting and malaise, fatigue, and headache. Um, but if you have those symptoms, it's really important that you go get checked and get on Tamiflu or Zofluza as early as possible because that's when it's, like I said, going to be most effective. So I hope that this is a useful discussion on influenza for you. And look forward to talking to you again soon with one of our medical chats. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.